You know, nursing was my first profession. It was definitely my calling in life. I always wanted to be a nurse when I was a little girl, and I worked in a variety of settings, from the emergency room to long-term care, and ended my career actually working for a health insurance company. So I had a wide variety of experiences as a nurse over 11 years. As a former registered nurse, I'm always going to be a champion for nurses because I know how hard they work, how much they care about their patients, and how difficult the job is. But I also really just care about access to healthcare. And right now we have a healthcare crisis. We don't have enough nurses and other allied health professionals. The whole system is just really, really broken. And, you know, patients and constituents are dealing with that lack of access to different types of healthcare. And so, you know, I'm proudly serve on the healthcare committee, and I've been working on a lot of different healthcare bills this session. I have one around nurses and nurse practitioners in particular, and making sure they have pay equity for the same work that they do as physicians. But I also have a bill around prior authorization. And this is not really centered around nurses, but it is centered around my experience as a nurse and advocating for patients to get health care they need, and the insurance company delaying that health care by demanding that they go through a process called prior authorization. If a patient needs a test or a certain medication, you know, the provider has to ask the insurance company in advance if it's going to be authorized. And this can delay care, but it also is a bureaucratic nightmare, and actually ends up costing the doctors money to have somebody in their staff dealing with all of these prior authorizations, and that's driving up healthcare costs. And there's some things where 95% of the time the insurance company approves it. So why do we even have to go through this process? And when people do need a test or a medication, I think the insurance company should give an answer within 48 hours, because a delay in care can actually lead to really fatal outcomes for patients at times. And so we need to reform this system.